Hello. Welcome, welcome. We are going to get started here. Hello, everybody. Hope everybody is doing extremely well. And I would like to talk to you for a little bit before we get started. So, can you guys hear me and see me okay? Let's see. I'm hoping that I'm just going to make sure. Can you guys can you hear me and see me okay? Yeah? Thumbs up, everybody? All right, cool. Awesome. I want to talk to you about um, why I decided to do this class tonight. So I've had some people, or not really some people. I've just heard some rumblings from people saying, I asked, like, are you coming to class tonight? Are you doing this? And I had some people say things like, well, I already know about that, or I don't eat, my blood sugars aren't high, or I don't eat a lot of sugar. That's fine, but people really don't understand the importance of what happens when you eat a lot of sugar. Like, it's so important to understand this. And the reason why I do these classes in this group is to help you guys and give you guys an education so you really understand it. Because you hear all from your doctors, you hear from your diabetes educators, you hear from, your nutritionist that everything in moderation, everything's okay. A little sugar is going to hurt you. I'm going to show you tonight that that's really not all of that true. I mean, it's somewhat true, but it's not true for everybody. So I really want to explain tonight the dangers of sugar, no matter if you have diabetes or not. For sure, if you have diabetes, you need to really pay attention to this. If you don't have diabetes, but you're having problems losing weight, or you're not feeling good, if you have chronic fatigue, that's all sign of probably some sort of a sugar imbalance. But the class tonight, I just want to help you understand how bad sugar is for you on your organs. That's really what tonight's class is about, because I think a lot of people just think, a little bit here and there isn't going to hurt you. Well, that's true, but it's not that simple. People will forget how much sugar they're actually eating, thinking that's not very much, and then when they go back and realize how much they've eaten, the sugar's already done a lot of damage. So that is what we're talking about tonight, and we're going to kind of get a little bit deep, and I'm going to kind of go into detail. So hope you have a piece of paper and you're ready to get to work. Okay, so that is the reason why I'm talking about this tonight. And high blood sugar is basically anything that is over 1 teaspoon in your blood. So let me explain this. This graphic is going to blow your mind. Okay, you have 5 liters of blood in your body. Normal people, about 5. You're a lot taller, if you're bigger, you might have 5.5 or 6, but most people have about 5 liters of blood in your body. Your body is designed to be able to manage 1 teaspoon in that 5 liters of blood. So 1 teaspoon is 4.2 grams. So if you're looking at food labels or you're reading labels, anything that has 4 grams in it, let's say, you're doing some yogurt. Yogurt has usually about 16 grams of sugar. Okay, so you're getting 4 times the amount of sugar that your body needs. So you have 1 teaspoon of sugar that is circulating in your body, and that's a healthy kind of range of sugar. That's what your body is kind of okay with. Your body, there's not a lot of inflammatory things that happen if you have 1 teaspoon floating around in the blood. But just zero point 0.5, 1/2 a teaspoon more, which is 6 grams, brings your blood sugar up to 126 milligrams per deciliter, which is diagnosed as prediabetes. So 1 teaspoon, if you took your blood sugar, 1 teaspoon circulating around, it's about 84 milligrams per deciliter. Great number reading. Great if you test your blood sugars, you know that that's a very good number. But 1/2 teaspoon higher, 0.5, is going to bring your blood sugars up to 126. Now, most people don't have an 84 milligram of deciliter reading. Most people's blood sugars are way more than that. And those of you who aren't taking your blood sugars, you don't even know what it is. I would bet you that it's a lot higher than the 84 at a fasted in a fasted state. Okay. So, potentially your body, when there's more than 1 teaspoon of sugar in the blood, your body panics because it wants to maintain 1 teaspoon. So when your body has more than that, it starts to panic. Okay. And long periods of time, like if that keeps repeating itself day in and day out, month after month, year after year, eventually your body breaks down, which is why you get prediabetes and why you get diabetes, because the body can't keep up with keeping only your blood sugar at 1 teaspoon. Okay, so this is why I wanted you to see this graphic, because it really puts things into perspective. When you're looking at grams of sugar in foods, you're eating way more than 1 teaspoon of sugar a day. And we're going to show you exactly how much you're eating. I'm going to have a graphic for that later. So excessive sugar consumption can have numerous detrimental effects on various organs and systems in the body. And here are 10 reasons and explanations on how sugar can damage the organs. Okay, so the top 10 organs and the top organs that it affects. The first one is the heart. High glucose levels damage the heart through several mechanisms. Okay, glucotoxicity is one of them. It's basically another name for sugar poisoning. And if you look at a human cell, now last week I talked a lot about arteries and cholesterol and why we need cholesterol. And I explained, and hopefully I showed you last week, how cholesterol is not why you have plaquing. Cholesterol is not why you have heart attacks, is not why you have, you know, heart failure. Okay. And I'm going to go a little deeper tonight. I'm going to explain to you why sugar is the cause. So these are two normal arteries. Okay. This one is the normal artery. This one has some damage to it. There's like a little rip there, a tear in there. Okay. Sugar, when you have more than 1 teaspoon of sugar floating around in the blood, okay, it puts pressure on the body. And think of that sugar like shards of glass. So if your blood is just full of sugar, those little sharp edges of the sugar start tearing the sides of the arteries and the veins. Okay, so you see this little tear and these little, so when that happens, that's what's causing inflammation. Now, these tears, remember last week I told you that when you have the LDL cholesterol goes in and it attaches to the damaged arterial wall. That's what's causing the blockages, is what's causing the plaquing, is when you have damage to the wall, the LDL goes in there to try to protect it, to try to heal it. Okay, so it's the LDL. Remember the small LDL, those are the ones that are attaching to the damaged arteries, not the large LDL. So when you go to your doctor, you're getting one number. You're getting the total LDL. You're getting HDL and LDL and total cholesterol. They're not breaking down how much small you have, small dense, pattern B, and how much large LDL, pattern A you have. The large buoyant don't attach to the inflammation. So when you eat sugar, let me show this graphic again. I want you to visualize this. When you have sugar in your blood and there's a lot of sugar in there and your body doesn't know how to manage it and it stays high, that sugar goes into the cells and it starts scraping on the arterial walls, which is what's causing the inflammation. Then you get the plaque that builds up. And then the arteries close and then things don't get through and then there's your problem. That's the problem. It starts with sugar, which then goes to inflammation, which then goes to the LDL, small dense LDL particles go in and cause the plaquing. That's what's causing the blockages. Now, there's a little bit more involved in that, but I'm trying to really simplify it for you. This is the process. So, for example, let's say your blood sugar is totally normal and you have high cholesterol. It doesn't matter. Look at all the cholesterol just goes right through just fine. All the cholesterol just goes right through the cell. It's not even a problem because your body needs cholesterol, as I explained to you last week. If you have not watched that video from last week, make sure you go watch the importance of cholesterol. It's not the cholesterol that's the problem. It is the inflammation from your sugar and other toxins, which we can get into too a little bit. But it's mainly sugar and other things that are causing damage to the veins and the arteries, and then the LDL goes in and starts to heal that area, and that's what's causing the blockages. So I hope this is clear because like I specified last week in the class, it's not the cholesterol that's causing the plaquing and it's not the cholesterol that's causing the heart attacks. Your body needs cholesterol. Okay, so that's that. So again, high sugar is causing that inflammation. The excess glucose triggers to release these pro-inflammatory cytokines, also leading to chronic low-grade inflammation in the blood vessels and the heart tissue. Okay. The next one it affects is the pancreas. So chronic high blood sugar damages the pancreas by beta cell exhaustion. So constant demand for insulin production leads to the beta cells in the pancreas burning out, therefore reducing the amount of insulin that your body secretes over time. So your pancreas is responsible for lowering your blood sugar. When it senses that there's a lot of sugar in the body, the insulin is released from the pancreas and it pushes the sugar into the cells and into the tissue, which is not good either, right? But that's it's protecting you to try to keep it out of the blood because as you saw, the body does not want sugar in the blood because it damages the arteries. So it tries to push it into the tissues, which is not good either because sugar then damages the tissue. The first priority is to keep it out of the blood to protect the heart, and then it just starts going into all the tissues and it wears everything else out. So it does affect, the beta cell production in the pancreas, and prolonged exposure to high glucose levels directly damages pancreatic beta cells through oxidative stress and mitochondrial dysfunction. Okay. The third the third organ that the sugar affects is the kidneys. So glomerular hyperfiltration. So as you guys know, the kidneys filter out, water, filter out the toxins from your body, right? So high blood sugar increases kidney filtration rates, leading to glomerular damage over time, the way the kidneys filter out the blood. Also, mesangial expansion. I know these are big words, but these are the words that the kidney doctors use. But mesangial expansion also is a problem because excess glucose stimulates mesangial cell growth, thickening the glomerular basement membrane and reducing the filtration capacity. Okay, so again, oh man, sugar raises havoc with your kidneys. If you're getting a lot of kidney infections, if you're getting a lot of kidney stones, if you're peeing a lot, if you have high blood sugars and you have diabetes, your kidneys absolutely 100% are being damaged. Okay, so your sugar is just not. There's nothing positive I can say about having high levels of sugar in your body. Number 4 is the liver. So sugar, especially fructose found in fruits and also high fructose corn syrup, harms the liver by de novo lipogenesis. And what that means is excess fructose is converted into fat in the liver. So I want to stop my screen here really quick. So when you're being told, oh, fruit is okay, if you have diabetes, fruit is not okay because all fruit has fructose. And fructose is the only kind of sugar in the body that turns to fat in the liver. Fructose converts to triglycerides in the liver. So when you're eating high volumes of fruit and you have diabetes, your triglycerides will be high and it is absolutely converting to fat. Fruit. So when you're being told by your diabetes educator, oh, fruit is okay, not until you heal your diabetes, if you have fatty liver, fruit should not be a part of your diet. Now, fruit is really healthy for vitamins and minerals. But if you've got a fatty liver or diabetes, the fructose in the fruit is causing a lot of issues. I know, I'm just the messenger. So the other way that it affects the liver is insulin resistance. So high sugar intake promotes hepatic insulin resistance, impairing glucose metabolism. So your liver takes a beating, a lot of beating in all areas through detox, through sugar, through it takes a lot of beating, but sugar really does a toll on the liver. All right, the brain. We got to talk about the brain. How does the glucose affect the brain? Well, through neurotransmitter imbalance. Fluctuating glucose levels disrupt neurotransmitter production and function, affecting mood and cognition. Also, there's vascular damage. Chronic high glucose damages brain vessels, potentially leading to cognitive decline. You guys have heard of type 3 diabetes? Type 3 diabetes now is Alzheimer's. It is dementia. So they've now made a new category type of diabetes within the last few years because they're recognizing that the sugar is causing damage to the brain. And that is why people are getting early onset dementia and early onset Alzheimer's. I know, pretty. Type 3 diabetes is not good. Not a good, not a good progression. Usually starts with insulin resist. It starts with insulin resistance, pre-diabetes, right? Then type 2, then probably type 3, maybe type 1. You know, it's a progressive disease. But here's the deal. The good news is that it doesn't have to be progressive. You can stop the progression of diabetes if it's not type 1. You can stop the progression of diabetes. But the longer you let this play out, the harder it gets. And eventually, you know, diabetes is 100% reversible, but depending how long you've had it, it'll either take a long time or you'll just be able to, you know, make sure that it doesn't get worse and not necessarily reverse it. But I've seen too many people reverse their diabetes, and some people who reversed it who have had major stage 3 kidney disease, and yeah, it's definitely doable, but you have to make sure that you find the right person that can understand the disease and help you to, um, you know, get on the right protocol to be able to reverse it. All right, number 6, your teeth. Sugar damages your teeth by acid production. Oral bacteria ferment sugars, producing acids that erode tooth enamel. Also, biofilm formation. So, sugar promotes bacterial growth and biofilm formation on teeth, increasing cavity risk. Number 7, skin. It affects the skin by collagen glycation. Sugar binds to collagen proteins, formulating AGEs that reduce skin elasticity and promote wrinkles. Also, impaired wound healing. So, if you have high blood sugar levels, that will interfere with proper wound healing. We've kind of talked about this, but blood vessels, it's not just the arteries in the heart, it's the blood vessels everywhere in your body. When you have damaged vessels and damaged nerves, that can lead to, you know, feet inflammation and edema and neuropathy. I mean, neuropathy is more of a nerve, but all of this is related. So blood sugar can damage any of the vessels of the body by endothelial lining. The endothelial lining is the endothelial lining dysfunction. So high glucose levels impair the nitric oxide production, which reduces vessel elasticity and promoting atherosclerosis, which is the hardening of the arteries. Oxidative stress, excess glucose increases free radical production, damaging vessel walls. And again, just that 1 teaspoon of sugar in the veins, you guys, in the body. We have 5 liters of blood in our body. 1 teaspoon circulating through the entire 5 liters is all that our body really should be having. So I'm sure you all can understand the importance of why we have to start decreasing our sugar intake. The eyes, this is a scary one. So many of my clients that come work with me have already had glaucoma and eye issues. Sugar is very damaging to your eyes. It causes osmotic stress. High blood sugar draws water into the lens, excuse me, causing swelling and blurred vision. Also, microvascular damage. Chronic hyperglycemia damages small blood vessels in the retina, leading to diabetic retinopathy. Yeah, not good. And you know, once you lose your vision, blindness, that is not reversible. So protect your eyes, ladies. Protect your eyes. And the last one I want to talk about is how sugar can affect your mood and your mental health. Neurotransmitter imbalances, rapid glucose fluctuations affect serotonin and dopamine levels in the brain, influencing mood. Also, high levels of sugar cause inflammation, and that promotes systemic inflammation, which is linked to depression and anxiety. Okay. So those are 10 reasons why it's very important that you guys start watching your sugar. So aside from the organs that it damages, eating too much sugar causes something called glycation. And glycation refers to the binding of sugars to proteins. So if you're eating grilled steak or grilled chicken and you're putting all this sugary barbecue sauce on it, that combination is really bad. It destroys the collagen in the blood vessels. Collagen is a structural protein found all over the body, not just in the skin, but it ultimately causes it to become brittle and form plaque. So causing glycation is very serious when you combine sugar with heat. Okay. Also oxidation. So think of when you think of rust on a car. So that oxidation process, so too much sugar also is causing like your cells are rusting, causing like oxidation in the body. So your tissues and your cells and everything get very damaged that way. Also, high sugar, which for reasons you can understand, causes the blood to get thick and sticky. So, think about this, like your blood is supposed to be kind of like a water consistency, right? So when you have high insulin and high sugars and that glycation, and then you're eating toxins, your blood becomes thick and sticky. So it's harder for your body to pump the blood through the heart. Why do you think so many people have high blood pressure? The blood is so thick and so sticky that your body has to work extremely hard to get the blood flowing. This is why a lot of people are on, blood thinners because their blood is just so thick and sticky. You can totally control your blood thickness, your health, the health of your blood by your diet. So if you're eating a lot of sugar and crap and that blood is getting thick, that's not healthy for the body at all. Okay. Um, so I want to also talk a little bit about medications. I'm not going to spend a lot of time on this because I've done classes strictly on how medications do not ever fix the underlying root cause. And when you're on medications, there's so many side effects to the medications that you're on. So, for example, you're on insulin. Okay, insulin, yeah, insulin does lower the blood sugar. It's similar to when I was talking about how a statin, you take a statin and it lowers cholesterol. But do we want our cholesterol low? That's the issue. No, we don't want our cholesterol low. So why are we on a statin? We always have to look at the why. Insulin's another one. Like doctors are telling you, yeah, go on insulin, insulin. Yeah, insulin does lower the blood sugar. Why? Because what insulin is doing is taking all that sugar and it's forcing it into the tissues. And what did I just share with you? What does all the sugar do in your tissues? It damages the tissue. So now your doctor has you on this insulin drug to try to lower the blood sugar. So when you take your blood sugar, oh, you think, oh my gosh, it's low. It's like 100 or 80. What all it's really doing is it's not getting rid of the sugar. It's pushing it into the tissues, and now it's doing damage in the tissues. This is why I am not a fan of diabetes medications because the medications don't fix the underlying problem. The medications force the body to push the sugar, which is like shards of glass in your body, push the sugars into the tissue and the veins and the heart, and it's causing all of this havoc on the damage in the body. So we've got to get you off the medications, but we can't get you off the medications unless you fix what's going on and you learn and you understand this stuff. So I never have been, I never will be. I hate medications. I think they do more damage. Yeah, the short term, sometimes short term, they're fine. I mean, that's what medications should be for, short term, to get over chronic whatever. But if you're on a medications long term, there's nothing but problems with long term medication. Your bodies aren't designed for medications. They're designed for good fuel, good nutrition. And when you take a medication, it affects all the other areas of your body. There's always a side effect of a medication, even though it might help with a symptom of in one area, it's always affecting and causing another symptom in the body. Your bodies aren't designed they're toxic. Medications are toxic. So my role and my what I do is I help women to create balance in the body so that they can get off medications. Yeah. No, no, no good. So why do we consume so much sugar? Well, we consume so much sugar because sugar is very addicting. Numerous studies have proven that sugar impacts us in very negative ways. Sugar is addictive. It's like a drug. It gives us a dopamine hit. That dopamine hit is like like crack cocaine. This is why when you have a piece of cake or you have that cookie or whatever, you feel like at the time it's like, oh my gosh, it tastes so good and it gives your brain a hit. And this is why it's so addicting. Fast food restaurants and processed foods contain chemicals and addictive agents for a reason. They know what causes the brain to have this dopamine hit. They want to continue, they want you to continue eating their food and buying their products. So they put sugar in burgers, they put sugar in sauces, right? And then, of course, everything else that's already there's sugars in, the diet sodas and the ice cream and the muffins and yeah, all that. It's just it's a very sad, sad state, sad situation that we live in. I mean, I was talking to somebody a few days ago. She was traveling. She was traveling to Europe, and she was telling me how um, she wanted to ship some supplements and some hair products and some things over to Europe. And you know that they won't let you take any of that stuff on the plane. It'll get stopped in customs. You can't bring anything over to Europe, any sort of food or any products over to Europe because they ban this stuff. And here in the US, we hand it out like candy. We sell it. Most of the toxic ingredients and toxic food is they don't even allow in Europe. Yeah. This is why we have to know this stuff because we are being poisoned every single day. Here is what I want you to see. The average American consumes 57 pounds of sugar in a year. Average American, 57 pounds. That's 4.7 pounds a month. Now, listen to this, you guys. Remember my analogy about a teaspoon of sugar? You need 1 teaspoon of sugar in the body at a given time, right? 1 pound of sugar is 92 teaspoons. So if we're having 4.7 pounds a month, we're consuming 437 teaspoons of sugar a month. That's 5,245.7 teaspoons of sugar per year. No wonder we have an epidemic of diabetes, heart disease, heart attacks, cancer, dementia, Alzheimer's. No wonder. This is why it starts with sugar. So, everything in moderation? Do you believe that? Do you believe we can have everything in moderation? I don't believe so. But according to John Hopkins, of course, it's totally okay to scoop on sugar. This is right off their website. For years, people with diabetes were warned to avoid sweets, but the research understands about diabetes and nutrition has changed. Total carbohydrates are what counts. It was once assumed that honey, candy, and other sweets would raise your blood sugar level faster and higher than would fruits, vegetables. This is what they're telling you on the John Hopkins website. They're telling you you can have your cake and eat it too. It doesn't matter. Moderation. Okay, well, yeah. They want to keep you on insulin and they want to keep you on medication. They want to keep you on statins. They don't care that your 10 teaspoons of sugar, 12 teaspoons, 400 teaspoons of sugar that you're eating every single month are causing arterial damage. They're causing damage to your heart and your kidneys and your pancreas and your brain. They don't give a flip. They don't care. Go ahead, look at this. Eat your rice, your crackers, your cereal, your fruit juice. And they're talking about diabetics here. It's just crazy to me. I wouldn't tell myself, like who's healthy and doesn't have diabetes. I wouldn't even tell myself to be eating this stuff. And they're telling diabetics to do it. It's just crazy. So it's what you eat. So how do you eliminate sugar? I'm going to give you a really simple solution. You don't start slow. You just go cold turkey. Will you have a couple withdrawals for a couple days? Absolutely. But sugar is one of those things where you can quit cold turkey. Not like cocaine. Cocaine you can't. I mean, but you're gonna have some symptoms the first couple of days. Maybe some headaches, but it's like you just quit. Knowing what you know now about how bad sugar is, you need to just stop allowing the bad sugars into your body. You got to quit snacking. You got to eat good fats. You got to eliminate all fructose. all fructose, especially those of you in this group who are diabetic, or you know you have insulin resistance, or you have a fatty liver. In the meantime, you have to eliminate fruits. Now you're going to hear so many people that, oh, she doesn't know what she's talking about. She's okay, well, whatever. I've proven you what fructose does. You can ask any um, holistic uh, naturopath how fructose is processed in the liver. You can ask anybody. Most doctors know how fructose is processed in the liver, but they don't want to tell you to quit eating fruit because they want you to, they want to keep you as their patient. So I would cold turkey quit eating sugar. I would quit snacking. I would eat good fats, good quality fats. I would eliminate all fructose for now. I would use stevia and monk fruit as not aspartame, not, all the packets that you find in the grocery stores. Stevia and monk fruit are the only two I would recommend. And then, of course, while you're trying to heal and get some decrease your inflammation, reduce your alcohol consumption. Okay. So, like I've always said, you're either feeding health or you're feeding disease. There's just no two ways about it. Okay. So next week, I want to talk about if you're having difficult time losing weight, and a lot of it has to deal with sugar, but there's some other reasons. So join me next week where I'm going to be discussing the 10 reasons why you are not losing weight. Now, one of those reasons, I'm just going to tell you right now, one of those reasons is what we learned tonight is sugar. Okay. But let's say that maybe you're not eating a lot of sugar and you're still having a terrible time losing weight and you're just frustrated. Join me next week because I'm going to talk all about that. Okay, you guys? Well, I really hope this was helpful.